The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Welcome to our Supervisor Learning Collaborative. We'll get started in another minute or two. We're going to allow others to sign on. I see we've got a limited number of people that have signed on thus far, so we're going to wait just a little while before we start. All right, I see other people have had a chance to sign on. Welcome this afternoon to our Supervisors Learning Collaborative call. My name is Dawn Miller. I'm with the Healthcare Authority, Division of Behavioral Health and Recovery, and we are hosting the Supervisor Learning Collaborative call series. We alternate between supported employment and supportive housing every other month. This happens to be a supported employment call. Our presenter today is Paul Phares, who is from the Public Consulting Group. We are recording this so that folks that haven't been able to attend, or if you'd like to hear it a second time, you're going to be able to listen at a later date when we send out the link. The beauty of these calls and the intent of these calls is that we're going to develop that learning collaborative. We're going to develop a scenario in which you have people you can call upon if you have questions between training sessions. So we want you to be able to ask questions, and we encourage you to ask questions because that increases the quality of the call. Having said that, Paul, are you set to go?
I'm ready, Dawn.
Okay, I'm turning it over to you.
Great, thank you again, Dawn. Good afternoon, everybody. As Dawn said, I'm Paul Phares, and I'm going to walk you through some content related to the individual placement and support model for supported employment, and specifically how executive leaders at organizations can really help with their buy-in, get some traction with implementing the IPS model in their agency. So our agenda today is very brief. but I have an awful lot of content I'm going to try to move through, and I do have a space near the end of the content for questions specific to what I cover, and even other questions related to IPS model and its implementation. So we'll talk about general knowledge and the core principles of IPS and the model, and then like I said, we will take a deep dive into executive support for the individual placement and support model for supported employment, what it looks like at agencies that have, very high fidelity to the model. I always like to have this slide, which is content overview, and it just provides some context. So the things I'll talk to you about today are not necessarily specific to state of Washington. I'll talk about best practices from across the nation, common approaches, and for the most part, full implementation with good outcomes. And you'll also see throughout the presentation today that a lot of what I'm going to talk to you about is really driven by the IPS Fidelity Scale. So making the transition to IPS services, this requires a lot of people in an agency to all be moving in the same direction, which is part of the reason that executive support is so important. Some considerations that agencies really need to weigh out are their policies and how their policies might change, what fee schedules are in place that might support the practice of IPS, supported employment, data collection and reporting, and then certainly payment models. Considerations for practice include the availability of benefits planning, an employment specialist time in the community, and you see laptop there in parentheses. Really, if you're in an agency where staff do not have access to laptops, with the IPS model's focus on community-based interventions, laptops might be something you really want to seriously consider. Meeting structure, and then the merging of a vocational and a clinical record. If you have an electronic medical record, that's great. You're moving in the right direction. If you're still doing paper charting, you're really probably going to have to take a real hard look at implementation of an EMR very soon, I would imagine. Considerations for supervisors. And by supervisor, I mean IPS supervisor. We would want this person in the agency to really be the champion for IPS services within the agency. They'll have to have a level of accessibility to the executive director or the executive team. There's responsibility for some record keeping for the IPS supervisor, and then really helping staff manage their attitudes and beliefs regarding the culture and the view of employment as a clinical intervention. For those of you that are aware, this is review. If you're not aware, IPS, one of the great things about IPS is that it has a fidelity scale. It consists of 25 items that are rated from 1 to 5, with 5 being the best score. And that's broken into sections, including staffing, organization, and services. And during a fidelity review, certain data sources might be interviews with both the employment team and others in the agency, reviewing the clinical documentation, and then, of course, observing the employment specialist in action. Some more context that I think is important to note. IPS Fidelity is followed by agencies that are doing the IPS services. And I say this because the IPS Fidelity Scale articulates certain things about Department of Vocational Rehabilitation, but that is all for the IPS agency to follow and manage. Vocational rehabilitation definitely has separate rules, separate guidelines to follow. This content that pertains to VR is really exactly that, is content that pertains to VR and the relationship, and specifically, IPS agencies are reviewed on how closely they align with that content. And as I indicated earlier, the examples that I talk about throughout this slide deck really are organizations that have had full implementation. They didn't start up 3 months ago, for example, and they have exemplary fidelity, which is basically the highest score you can get during a fidelity review. Just a quick review on IPS core principles. These are really the values, I think, of IPS. On the left-hand column here, the bullet points, you've got the core principles. So zero exclusion, rapid job search, integration with mental health services, competitive employment in the community, time unlimited support, attention to preferences, continuous assessment, and benefits counseling. Points are assigned to each principle during the fidelity review. An agency's total fidelity score, like I said, represents how closely they align with the IPS principles, and the levels of fidelity are are there listed below. Now let's talk about executive support. The graphic here says top-down. That's how I describe executive support for IPS. It really does need to be top-down. Employees throughout all levels of the agency really need to hear from the executive team how important supported employment is for the clients they serve and how it fits in with the mission of the agency. And there are some specific ways that the IPS Fidelity Scale actually looks at the executive support. So I kind of package this into what I call the executive essentials. These are the handful of things that executives at an organization that is either starting IPS or is all in with IPS really needs to kind of have at the ready or be able to speak to. The first is an elevator speech, and I'll talk a little bit more about that in a few slides. IPS would be ideally in the quality assurance program at an organization. This is a fidelity item that agencies will get reviewed on. Executives need to be involved in the IPS services at the agency, and again, this is a fidelity item. And really, a lot of IPS providers are coming from the perspective of mental health providers, and the organizations that do it the best seem to have a conversation about recovery that naturally includes employment as an outcome or an indicator of recovery. So some places have recovery scorecards, for example, and I'll talk a little bit about that later. And then certainly, I think a real power that executives bring to the table is leveraging relationships that they manage, both in the agency, between agencies, and then in the community as well. So back to that elevator speech. You may have heard of it before. It's a concept that's been around for a long time. Definitely not my idea. More of a sales approach than anything. But this elevator pitch, elevator speech, it's really just a short description. It explains IPS in a way that anybody could understand it in a really short period of time. This elevator speech would typically characterize what IPS is, why it's needed or how it can help, and how to become involved. And so you can see there that covers a wide variety of audiences with that content there. It's called an elevator speech because it shouldn't take much longer than an elevator ride, so 30 seconds to 2 minutes. And some potential audiences for this elevator speech include staff or employees, colleagues, board members, and even potential employers in the community. And I'll tell you just briefly, one of the agencies I've been to that I think does this really well, their executive leadership team actually does rounding throughout the organization during the year. And this rounding is basically they will go to Department A, and when they're talking with the staff in Department A, who may not be the IPS team, in that rounding, their messaging includes how to access the IPS team and exploring with that group that they're in front of, how can we make it easier to get employment services to the folks you serve in this department. And what you find is throughout all levels of the organization, staff everywhere hear it regularly throughout the year about IPS and why it's important and how it fits with the values. And it really goes a long way to making it part of the culture of an organization. I mentioned there is Fidelity Scale items on executive team support. And so these 5 bullet points here, basically it's 1 point per item. And if you want to get 5, you'd have to show evidence of all of these. So agency executive team members demonstrating knowledge of IPS, QA process, including a review of components of the program at least every 6 months, at least 1 executive team member participating in the IPS Steering Committee, agency CEO or executive director or executive team members communicate to all agency staff how IPS supports the mission of the agency. And lastly, IPS supervisor shares information about IPS at least twice a year with the executive team. And that can be formal or informal. I will caution you, informal. My experience tells me those are typically harder to provide evidence of in a fidelity review. So even if it's something as simple as making meeting minutes out of an informal sharing of information about IPS can help go a long way in the fidelity review. So the Fidelity Scale item agency QA process includes an explicit review of the program at least every 6 months until high fidelity is reached. Really, the second sentence I think is the most important. The agency QA process uses the results of the fidelity review to improve implementation and sustainability. What's great about this is it takes the IPS team's work, and when you put it in QA, in the QA system you have your organization, it really elevates the monitoring higher than the IPS team. It makes it agency-wide. Most organizations who have a QA process somehow publish their QA results with their board, for example. So it gives this executive level monitoring, it gives a board level monitoring, and then again, most places also push that QA data back out to staff at all levels through various ways, a scorecard like I talked about earlier, or even just publishing the QA report internally. It really does a good job of making more than the IPS team have eyes on the performance. This executive team and IPS knowledge, really the philosophy here is that the knowledge about IPS shouldn't be limited to the IPS team. Certainly, when I do a fidelity review, I don't need the CEO to give me a 13-page dissertation on IPS. Far from it. I'm more interested in high-level connections they're making. A general understanding is fine. Do they understand the philosophy of IPS and why it's different than traditional supported employment? Understand the resources in place within the organization. Maybe some key practices or even some of those principles. I've had executives talk about the principles in fidelity reviews, and that's perfectly fine. But I really don't go into these meetings with executives expecting that they have full knowledge of all of the operational ins and outs of the IPS team. But that's why the fidelity scale also requires that IPS supervisor to report back to the executive team regularly in order to get high fidelity. I mentioned the IPS Steering Committee earlier, and if you're not familiar with it, that's essentially a group of stakeholders just for the IPS program. They are tasked with reviewing the fidelity, reviewing the implementation, reviewing the service delivery. It can be comprised of a wide variety of members. Some examples include the IPS team members, certainly. I always think it's a good idea to include clients or families who are receiving the service. Vocational rehabilitation counselors are a natural fit for the steering committee. Either current employers, potential employers, past employers do a great job on steering committees for the IPS team. And then having at least one member of the executive team serve on the IPS steering committee can go a long way in your fidelity review to just getting high scores in this fidelity item because they'll be naturally looped in. Now that executive level could mean CEO, COO, clinical director, QA director. Each agency really kind of has their own terminology, and I just encourage you to do what makes sense for your organization. The rationale there is, high level. At this high level, the IPS Steering Committee can authorize organizational changes with these key stakeholders on the team. It makes the accountability larger than just the employment specialists or the IPS team, and it really integrates it into the organizational culture. The steering committee, I had somebody explain it to me one time, they regarded it essentially as the board for the IPS team. I think it's a really good way to think about it. As I said, agency titles, choose what makes sense for your agency. If you don't have a QA director, but you've got this other title who, part of their scope of responsibility includes QA, that's okay. I think that's totally fine. During a fidelity review, the evidence of this steering committee meeting lies within the minutes, right? So make it a formal meeting, make it a proper meeting, have someone do the minutes. You can rotate that every time you meet if you want, if nobody wants to have that job. But keep it in a binder so that when the fidelity review time comes, you can just hand the binder over to the reviewers and say, here's all of our steering committee minutes. The agency CEO or executive director of communication, I think the reality is employees really tend to pay attention to what their leaders talk about. In a fidelity review, the fidelity scale looks for at least annual agency-wide communications, and that can be, again, a variety of things. It could include any sort of all agency meetings or all staffs. Some organizations have those, once a quarter. Some have them once a year. Certainly, agency newsletters, emails. There was an organization I worked with one time who had a CEO that did, I think it was every other month. They called them email blasts, and the email blasts were designed to go out to all of the employees, and they highlight certain departments within the organization, certain staff. They celebrate milestones like retirements and birthdays and so on and so forth. But in these email blasts, they were putting specific IPS content several times a year. And what was great is, again, you can just print that email right out for a fidelity review. You've got your evidence that the executive director is doing the communication regularly. I went to an agency one time that I thought was very cool, that their CEO does a podcast every week. And long story short, the podcast, about every third podcast, highlights something related to the IPS team, the employment services for the organization. And I thought it was a really innovative, neat idea. Not everybody can do a podcast. Not everybody wants to do a podcast. But again, think outside the box. There are a lot of ways you can meet some of these criteria. In job interviews is another way that we've seen agencies kind of put the IPS team in the forefront, and even in interviews in the community. And then I mentioned the executive rounding example from another organization earlier. For high fidelity scores in this section, it does say very specifically in the fidelity scale that this cannot be delegated to another administrator. So in this particular part, the executive team won't quite meet the criteria. This really has to be coming from the top down, from the agency CEO or executive director, in order for the score to be high fidelity on this item. The statement, IPS supervisor shares information with agency executive team. I talked about that briefly a little earlier. These can be one-to-one meetings. It can also be sort of executive team meetings where the IPS supervisor is part of the discussion. This is where the IPS supervisor would share operational knowledge, ask for assistance with barriers to implementation. Really what happens is this increases over time. This increases executive investment in the IPS program. If the IPS supervisor is talking about employment outcomes, and the executive is asking questions about why they are at the level they are at, it's a perfect opportunity to talk about, well, there's this barrier or that barrier, to get some executive buy-in to help eliminate those barriers. I've seen this look a variety of ways. A lot of these can be outcome-based discussions at that executive level. Maybe it's just a very high-level sort of outcome report where they're talking about job starts, or maybe they're talking about employment milestones, where people employed 15 days, 45 days, 90 days, et cetera. I've seen at this level, I've seen it talked about in regards to a contract between the agency who provides IPS services and the Department of Vocational Rehab, and how have we maximized the contract amounts, how far away are we, and what do we need to do in order to maximize the contract. These are labor discussions. They could be labor discussions regarding adding staff. Certainly content regarding integrating IPS within the organization to a greater degree. And they really assist, they arm the CEO or the executive team with information to do these executive to executive communications for internal stakeholders, certainly. But often what you'll hear is, in this setting, the executive team is armed with information even to go out to external stakeholders and talk about barriers with external stakeholders that the IPS team is reporting. And sometimes the executive to executive communications really are where the rubber hits the road with regards to moving through those barriers. I talked earlier about agencies really embracing employment and kind of looping it into the discussion when they're talking about recovery. And the reality is, historically, supported employment has been seen as this sort of adjunct to treatment, this sort of other thing you could also do. And part of the problem there is, we relied historically on this readiness model that people had to take their medication and then be symptom-free and then stay out of the hospital, et cetera, before they could work. It was very prescriptive. It was very non-individualized. IPS really turns that on its head. Employment is treatment. It's individualized. It's strengths-based. It's evidence-based. It's relationship-based. It's everything that all of the other treatments or services at a center are. And so advocating for recovery really has to be advocating for employment. I mentioned leveraging relationships earlier too. Getting agency executives involved helps them leverage their professional relationships. I talked earlier about board support. Seeing that QA data on the IPS team and its performance really helps the board understand IPS. Board is typically comprised of folks from the community, stakeholders from the community. So the board now knows about IPS and sees how we're doing with IPS. So therefore, the board in their daily doings can have an interaction about employment at your agency. It really helps executive communications. And then that steering committee attendance, I can't underscore its importance enough. You might not be able to get your CEO at every single steering committee meeting, and that's okay because they'll see the minutes. If you can get them to 2 or 3 a year, you're doing really good work. So anything is better than nothing with regards to their presence at the meetings. Again, their colleagues, their cohorts, they're armed with information. All those colleagues and cohorts that they interact with on a daily basis are potential employers for your IPS team. And one of the things that's been kind of a byproduct in this leveraging relationships discussion with executives is we have found that employers who are maybe, I don't want to say on the fence about working with us, but they weren't sure where to start, let's put it that way. Having an executive level employee say to them, here's what I know about the IPS team, you know, and give them the elevator speech that I talked about earlier, that really does break down some of those walls of stigma that are really easy to run into when you're out in the community trying to help somebody find a job with a disability. Funding strategies, it's always good to have executives looped in on how to help pay for everything, right? We've talked with a number of agencies that, like I mentioned earlier, they, in order to help kind of fund this IPS agency-wide service, they start to manage voc rehab contracts. And some of these contracts are milestone contracts that are outcome-based, and they cover some, but not all of operational expense for the IPS team. There's also, in some states, again, remember, I'm not talking about Washington-specific funding, but Medicaid-based reimbursement for fee-for-service revenue, which could cover some employment functions. And really, whatever state you're looking at, it is very clear that there is not a one-size-fits-all option. Each state is different. Each state has different opportunities and different challenges. The states that have seen the most success tend to braid funding streams to support employment services, primarily because there isn't one funding stream that will pay for everything. So the braiding of funding stream really, that seems to be some of the most successful choices that states have chosen. Other things to consider are grants. You know, it is a SAMHSA evidence-based practice. And so statewide redesign grants, you know, employment should be fair game, waiver-based grants, and even population-specific grants. Grants are great. They can start with starting up your IPS program. They can start up IPS-specific teams that treat specific age ranges, specific populations, specific diagnostic categories. And adding employment to a grant opportunity is something I really encourage you to think about, and I will give you some examples here. If you're familiar with coordinated specialty care, it is an emerging practice for individuals who are experiencing their first episode of a psychotic disorder. And one of the things we have seen agencies do successfully is add an employment specialist into this coordinated specialty care, team-based care for this younger population who is experiencing the first episode of a psychotic illness. By having employment be available there, we have seen it can help people not get stuck in the loop of being on entitlements forever, and it can get them access to excellent benefits through their employer. Other grant opportunities where you could add employment, and it makes a lot of sense, include integrated health settings where perhaps you've got a team of individuals and they're working with, let's say, a primary care provider or a federally qualified healthcare center. There's an awful lot of opportunity there. And then IPS has been repeatedly shown to be very effective with veterans. So we have seen some agencies that have implemented what they're calling a veterans care team, which includes several clinicians, among them IPS clinicians who are also working on employment as a direct intervention in addition to the other direct interventions. So what I like to do with the content is just kind of get through it, and then I like to just put some questions out there for reflection. And so Dawn helped me monitor the chat. I'm just going to go ahead and start. As a leader in an organization implementing IPS or an organization that has implemented IPS, what blind spots, and I mean unknowns in the model or the implementation, are you all thinking about right now? And this could be things that you know, but you don't know how to do, or it could be things you don't know yet. And we can talk those through.
You can either raise your hand if you'd like to be unmuted, or you can type your question into the chat box, whatever works best for you.
All right, I'm gonna, oh my gosh. I'm gonna do the next, I'm gonna put all the questions up here, Dawn.
Okay.
And then another question I had for the group is, have you identified certain levels of staff that may or may not embrace IPS principles, such as no exclusion, rapid search for employment? What strategies have you tried to move away from a readiness approach to supported employment? So, you know, that's the kind of historical version of supported employment was readiness, and IPS is a very different model. What things have you tried in order to move away from that readiness approach in your organization? And then my last question is, have you found anything in the Fidelity Scale that is trickier than others for your agency to implement, or really feel like you're getting it right?
So, Paul, one of the comments that I see in the system made by Kara Cooper is some of the blind spots we run into in FCS supportive housing is not knowing what notes other providers want to have entered. So, example, a client wants HUD waitlist application. So, sounds like you know, some of the walls that are placed up in an electronic medical record and not allowing notes to be seen from one team to another. Is that right, Kara? Is that kind of what you're talking about?
Yeah, I think the best answer I could give for that question is if you look at the IPS Fidelity Scale, it talks about the employment services being fully integrated into the clinical record. And I feel like that's what you're saying, Dawn, and that's what the question was, is that causes a problem when it's not fully integrated, but perhaps you've got some people who have their notes in this little compartment, and then other people have their notes in this little compartment, but nobody can see each other's little compartment of the electronic medical record.
Right.
There are situations where you have to wall off parts of an electronic medical record, and it's a very good reason to do that. However, I think I don't have a short answer for that other than to say if anybody on a clinical team is going to work together and be effective, we probably need to find out a way we can help them see what each other is doing.
Right.
And if the medical record won't support that, then that's where I think the parts of the Fidelity Scale that talk about integration with the teams really come into play, because then I would expect, as a Fidelity reviewer, I would expect, okay, so you can't see in the medical record what this other part of the team is doing. Well, do you talk about it in your meetings? You know, do you have a checklist in your meetings where you say HUD is applied for, yes or no? Mm-hmm. And you know, I'd want to look at those minutes and maybe watch maybe observe a clinical team meeting with the IPS team members present, just to kind of see how that communication works, because it will be very difficult if that information isn't exchanged, you know, timely and fully.
Mm-hmm. Yeah, she responded back with, yes, it would be nice to see other notes in provider one. So that was her response back. You know, you'd asked
all the more reason for, oh, sorry, I was just going to say all the more reason for executive support. Sometimes, you know, somebody on the executive team will need to champion that cause, which is a barrier for the IPS team. Sometimes an executive level employee will need to champion the cause to expand the access of the medical record to different parts of the organization. Yeah. So again, that's the sort of top-down ownership is very helpful.
Mm-hmm. Which is going to happen if the executive team attends some of the meetings that direct service staff also attend. Kara wrote back and said, we're going to be migrating to electronic health records such as NetSmart, Avatar as an agency. So yay, that's good news.
Yay, yep.
So Paul, you had asked too, one of your questions was, have you identified certain levels of staff? I actually was a provider, direct service provider within a mental health agency for 21 years, and really found that a lot of the therapists within our agency were the ones who were the gatekeepers that said a person's not ready because they need to work through this or that or whatever. And I think what I found personally over a period of time was as we started attending I would attend some of the therapy team meetings, and attending those team meetings and sharing success stories was huge in regards to getting them on board. When they could hear that individuals with significant challenges were succeeding, that caused them to be more open to the idea of, well, maybe we don't have to wait until they're done with this or that.
Yeah, I think you're right. And I always tell teams, really, you have to focus on getting one victory with everybody who doesn't believe in IPS. As soon as you get that one victory, they will be a believer forever. And I say that because from agency to agency that I go to, if I had a nickel every time, some psychiatrist or some therapist or some case manager or some executive told me, oh, well, gosh, you want to talk about success stories? We never thought Bob would get employed. When we got that referral, we all rolled our eyes. But yet here's Bob, who's been working for, several years successfully in the community. And even bigger surprise, his symptoms have abated and he's maybe not going to the emergency department all the time. And, those sorts of successes are really what makes believers out of folks. And I'm glad nobody answered this question out loud because it was really just bait. It was mean of me to put it in here, Dawn, but I did it anyway. There isn't any sort of specific, discipline that does or doesn't embrace IPS principles. And I'm glad you talked about therapists, Dawn, because it's everywhere in an organization. People think what they think, and it's not right or wrong. But again, the whole way you impact that is you get the message out, the top-down message, that it fits in with the mission and the values. At organizations I've seen too, one of the struggles, one of the biggest challenges for some agencies would be, or has been, I should say, psychiatrists who have been in practice for several years, and I'm talking like 20 years or more, who come from, they kind of even started practicing maybe when the recovery movement started happening. And so, you think about how slowly change really does happen organizationally and industry-wide. Sometimes those folks they have practice patterns like we all do, and really it's just a matter of giving them the information and the research associated with IPS. I've never talked with a medical provider that I've shown the research on IPS and its effectiveness to, that has told me, well, I don't care what the research says, I'm still not going to refer. That medical professional really hinges upon data-driven decisions. So if you can help them by providing data, often they become some of your biggest referral sources.
Yeah, we in fact saw that in the agency that I worked for. We had two advanced registered nurse practitioners, and both of them referred to supported employment on a periodic basis as part of their treatment. They believed that it was part of the treatment.
ARNPs are good for that. They have a holistic approach to healthcare that is different from other professions.
Very definitely. Other questions? Feel free to raise your hand, to type in the chat box, to ask to be unmuted should you like to ask your question verbally as opposed to typing it. I love the fact that you put in the question about readiness, the zero exclusion kind of thing. And I'm just a strong proponent for sharing success stories because I think that impacts positively all of the principles within IPS. I think you end up with far more towards zero exclusion when you start sharing those success stories. I think that you end up with leadership buy-in when you share those success stories. I think I think it's pretty huge in regards to changing minds and improving implementation when you're able to figure out ways to share success stories.
I agree, Dawn. And I think one of the things we've seen at agencies is sharing those success stories in settings like in a group, maybe having a guest speaker that is a client who worked with the IPS program, having brochures, flyers, posters in and around the agency waiting areas really helps clients understand that this is something, they don't have to get their doctor's permission or their therapist, their therapist doesn't have to agree to it. They can literally read the brochure and tell the person sitting behind the desk, hey, I'd like to go find a job, and they'll get them linked up with the IPS team. And that level of empowerment, there are a lot of clients who, go to your average sort of mental health center agency, social services agency, and there's a level of passiveness that goes with it. They show up and they do, I'm here for my appointment, I'll do my appointment and then I'll leave. And so there's a level of empowerment for folks who maybe haven't ever thought about employment before, just by having the brochure, the flyer, the poster, or having a peer talk to them in the right setting, in the right format, have a peer talk to them about what it did for their life. Because I will tell you, I've been in this field for a long time, and I have never worked with a client who didn't want a couple extra bucks at the end of the month in their pocket.
Right.
And just from that context alone, you can get a lot of referrals just by thinking about employment income with people.
Yeah, I love that you brought up the idea of bringing people that have their own success story to tell into group settings where a person might do that. I know we had a team meeting at one point in time where 3 individuals agreed to come in and share their stories, and at times staff were tearful because the stories were so moving. Definitely, I ended up hearing a lot of positive from clinicians and staff that maybe hadn't considered referring people to supported employment after hearing what the individuals themselves had said about their successes, were far more willing to refer. Yeah, it was a pretty cool thing.
Yeah, I believe it.
I'm looking through to see who else has questions, or I'm not seeing any raised hands or any chats right at the moment. So one of the reasons that when you had started talking about topics that you might address this particular session, one of the reasons that I had thought, working with executive leadership, things that you might do that would help them to buy in was so important, because I've seen agencies struggle with that. And if your leadership isn't bought into the idea of recovery and supported employment, it's an awfully hard row to hoe. So what are some of the things, sharing success stories is something that we identified as important. Having leadership attend various different meetings, or having a representative of a supervisor attend leadership meetings is awfully important. What other kinds of things have people run into that have helped perhaps well, I'll share a story. I've got one that I can share. I don't know if all of you are familiar with Joe Maroney. Joe's a buddy of mine, and he's nationally known and a wonderful presenter in my mind. Number of years ago, he came to the agency that I was working with and did a presentation related to supported employment and IPS and recovery. And he is the reason that the executive director at that point in time changed his mind about supported employment. So sometimes pulling in folks like you, Paul, like Joe, some of the nationally known experts can make a huge difference related to leadership buy-in, and just providing that education, which may be lacking. Maybe folks haven't heard as much about supported employment as they might want to. So that was Leroy was the executive director's name, and Leroy said several times, Joe Maroney is the reason that I changed my mind. And he actually ended up getting the IPS book, read it from cover to cover, the Fidelity Review, book that goes along with Fidelity Reviews, read it cover to cover, and became a very strong proponent for recovery and supported employment.
That's a good story, and that's how easy it happens, Dawn. For whatever reason, sometimes it's just getting in the right conversation with the right person at the right time that really leads to buy-in. Other things that I would point to, I am the kind of person that really suggests being as inclusive as possible with executive leadership. They're busy people, right? And they're in a lot of meetings, doing a lot of things. Mm-hmm. But when you're including them, I think, an important thing to remember is you have to be able to kind of speak their language, because the language they speak mm-hmm. is different than, your average clinician's conversations every day. And so, being able to talk about the benefit, not just the benefit from a treatment perspective and a kind of social domain outcome, but, how does the agency benefit from a strong employment team and a strong employment culture? Is there an opportunity financially for the organization? Not like we want to do things because they're, going to get us a lot of money, but we, as clinicians, we could be better about thinking about the financial part of our services a little mm-hmm. more often. Mm-hmm. Often big ticket decisions are made at the executive level based on dollars. So, finding opportunities for funding. I had the slide up there that I talked about earlier. If you're working in the organization in any capacity where you're helping write grants or, be the think tank for grants, think about how an employment specialist will help that grant. Whatever the grant is irrelevant. Employment specialists will help everybody. If you look at the research, any employment you bring to the table that's IPS employment is way better than not having any employment at all, or even having less than IPS. Mm-hmm. So if you're, working on a grant and, you've got some executive level leadership involved, there's an opportunity to talk about IPS and how it could enhance the team that you're putting together as part of this grant. And oftentimes, that's the way you get those little windows of opportunity to bring another employment specialist on board.
Mm-hmm. Absolutely true. Amanda, my housing colleague, and I ended up going and talking to a tribal group here a week or so ago, and they were talking about supportive housing specifically. They were talking about funding and funding streams, and I said, just kind of keep in the back of your mind, if the people that are in the housing start getting employment and are able to pay some portion of their rent, that becomes part of your funding stream. And the gentleman that we were talking to, the executive director in that case, said that we'd given him a lot to think about, but that wasn't something he'd necessarily considered before. That and a variety of other things that we had to say that day, but it's truth. If individuals are in supportive housing programs, they have far more options as far as housing if they are working and have some income in order to be able to afford to pay all or part of their rent. So it's important for so many reasons. But the fact of the matter was, in the case that we were discussing with the executive director in the setting we were in, was that it really does become part of the funding stream if people are paying for their rent when they had previously paid free rent. So I'm looking to see if there's any hands up. And I don't see any right now. I don't see any new questions. So I guess I would just ask the group, do you have questions other than those that Paul brought up as far as questions for reflection? Have you had specific scenarios where you might want some input from your colleagues? I saw, Paul, that you put, have you found any portions of the Fidelity Scale to be trickier than others? I like that question.
There's a few parts that are tricky, and I'm convinced that they're designed that way.
Yeah, I'm convinced as well. One of the things that we've found is that, and I recognize some of the names of the attendees, those people that are working for agencies that are not behavioral health agencies, which is what IPS was written towards, have run into a number of challenges just because IPS was written towards working in a behavioral health agency. So some of those kinds of the collaborating with treatment teams kinds of things when you're not in an agency that's a behavioral health agency and you're trying to collaborate with a case manager or a therapist can be very tricky. So I know.
Yeah, I agree. And on that same note is a place where agencies that are, let's say they're not classified as mental health centers doing IPS, a place they struggle pretty regularly is that being in proximity to the mental health team that you're serving, and often that's really through no fault of their own, they have to have an agency let them in and give some office space in order for them to meet that criteria often. And that it's just a challenge all around.
Absolutely, yes. And I know it's one that we're going to be helping agencies to address over time. Collaborating with whoever might be a person's support when you're providing services to a person is an important thing to do. So we're going to be doing some training upcoming on that over in Spokane the end of May. And I'll send out a flyer so that people have access to that training should they want to attend. But this would be an ideal spot too to have that discussion in regards to how are people managing those kinds of challenges.
Yeah, and on that note, again, Dawn, now more than ever, there are so many different ways to collaborate that are what I would call non-traditional, sitting in a meeting in the same room. And so I encourage people to get creative because now there are so many tools available to you now. It's easy to be creative.
Absolutely the truth. Yeah, Skype is here to stay. GoToWebinars and GoToMeetings are here to stay and are an effective way of communicating. Yeah, we talked a little bit about success stories and that kind of thing. One of the things that I was introduced to that I find kind of amazing is photo voice. Has anybody heard of photo voice? It's something that's been used in a few cases here in the state of Washington, where individuals are given a camera and they are able to go out and take pictures that are meaningful to them related to their recovery, whether it's supported employment, supportive housing, or whatever it might be. And then they're produced into a video or a website with a photo album kind of thing, along with either written or verbal narration by the individuals who've provided information for the story. Very powerful, very moving, something that I know we're going to use more of. I have examples of those if anyone's interested in seeing some of the examples. We have our wikis where we've posted some of those kinds of things so that they're accessible to folks, and just amazing kinds of things. All right, well, we have a quiet group here today. So I would say if there aren't other questions at this point in time, we may go ahead and end a little bit early. I do want to encourage you to tune in next month. So on May 13th, it will be a supportive housing supervisor learning collaborative call. Yay, Paul, you've got it up there. Are there any questions before we close? Questions or comments? I thank everyone for attending. We'll be sending out some links with other information and also with this recording so that you can share with others. All right. Paul, do you have anything else you would like to add?
No, even though it's a quiet group, I just want to make sure people know that if they're after the call, Dawn, if they want to send you additional questions, maybe they didn't feel comfortable asking, or additional ideas for future webinars, I'm happy to hear that feedback as well.
Oh, wonderful. Thank you. I will make sure to solicit those kinds of questions and get them to you. Thank you so much, everyone, for attending today. We're going to go ahead and end the call at this point in time, and we look forward to your attendance next month. Thank you so much.